Hello and welcome back. We are going to be looking at some of the normal ECGs that you would see in your diagnoses. So this is a normal sinus rhythm. The rhythm is regular. We have a normal rate if we measure it of about 60 to 100 beats per minute. Our P wave is normal here. We have a P wave before our QRS complex. This is our Q wave RS. Okay, we have a normal PR interval. And we have this normal QRS complex. Okay, so we're going to see this T wave as well and a normal pattern rhythm here. This is, again, normal sinus rhythm. So let's look at some things that are abnormal. Let's go up. Okay, so this is a very abnormal ECG. This is what we call asystole. We have no rhythm present. We have no rate present, no P wave, no PR interval, no QRS complex, and this is flatline. So we're going to have to confirm with multiple leads, and we'll also start life-saving CPR. And if no rhythm returns, then you would declare time of death. Okay, so we are looking here at another irregular pattern. We have an irregular rhythm. We can see it doesn't look quite like our normal rhythm did. And it is fast. We have ventricular rate that seems to be about normal with this QRS complex, but our atrial depolarization is varied here. Okay, it is going to be very fast, about 350 beats per minute if we measure it. And this P wave is really erratic. Okay, we really can't see where that P wave is. We might consider it absent or erratic. Therefore, we can't really measure our PR interval. So we won't be able to take that into consideration either. Now, we do have a fairly normal QRS complex, and it might be widened a bit. Sometimes you have conduction issues when you have this atrial, when you have this irregular atrial beating. Okay. Now, if we're going to look and we're going to make a note about this, we're going to pick out whether it's tachycardia, bradycardia, whether it's fibrillation. What are we looking at here? So it is the atria beating fast, right? That's tachycardia, but it is irregular as well. So if we look at the ventricles, they're beating regularly. So they're in a normal pattern. So when you try to diagnose this, you're going to be looking at atrial fibrillation. We have this irregular loss of synchronization in this atrial area. So we would diagnose this as atrial fibrillation. Let's look at this, for example. Looks a little bit different, right? So we have here a regular rhythm. It looks regular, the pattern is regular, but it is very fast. We measure our rate here. We're looking at about 100 to 200 beats per minute, somewhere in there regularly with this rate. And if you look for your P wave, you notice that the P wave is absent. So again, if you have an absent P wave, you cannot measure this PR interval. And our QRS complex is bizarre, right? The appearance of this is bizarre. This is your QRS complex here. QRS complex is going to be very irregular, and we really can't, we're really seeing that it's widened. Okay, this interval of the QRS complex is much wider than our normal rhythm or pattern. Because we have an increase in heart beating here, because we don't have a measurable P wave or PR interval, then we're looking at ventricular tachycardia. We're looking at this ventricles overtaking the atrial beating, and the measuring of the atria is not going to be accurate here because the ventricular tachycardia is taking over. Okay, and let's look at one more. We're going to see this ventricular fibrillation. Ventricular fibrillation is when you have this irregular wavy pattern. It's very, very irregular rhythm. We can't measure the rate. We can't see if we have a P wave, if we have a PR interval, because we can't see if we have a P wave, and we can't see if any of these might be our QRS complex. What this tells us is that because of this highly irregular pattern here, some might be P waves, some might be QRS complexes, but we can't tell. The EKG looks like it has a wavy line. Now the ventricle is having much higher marking on our ECG. So we're going to assume that this is ventricular, and we're going to assume that it's fibrillation because it's irregular. So this synchronization that has been lost is going to cause this irregular wavy pattern of ventricular fibrillation. Okay, so take some time now to go back and fill out your heart diagrams, your conducting system diagrams, and look at those ECGs. Go through your exercise 30 and 31 so that you can contribute to your clinical applications, the discussion, and be prepared for your upcoming quiz.